Antibiotics can be overused, but certainly in the last 20 years, we found more need for them than previously recognized. The best example is for about the last, actually not quite 20, maybe 17 years. Um, in the medical literature, there was a description of something called protracted bacterial bronchitis, which the classic presentation is a preschooler who has a wet sounding cough that goes on for weeks at a time. And if they also develop ear infections, sometimes they'll get 5 days or 7 days of amoxil for the ear infection, and parents will say, jeepers, the cough was a little bit better while on the amoxil, but it's never long enough course to fully eradicate the organisms that are in the lower airways, in the bronchial tubes. Now, this used to be misdiagnosed as cough variant asthma, and it wasn't until a group of research doctors, clinicians in Australia decided, you know what, we're going to start to perform bronchoscopy and get secretions specimens on these kids more often. And they were the ones who initially described it. It was actually slow to catch on in the US. The next paper on the subject really didn't appear till about 2011, 2012. I think it's being more widely recognized. In fact, now we know it's quite common. And I like to do bronchoscopies, and I like to know what I'm treating. But in some places where that test is not available, or if parents are unwilling, they actually have guidelines now that if the child fits these criteria, then a 2-week course of antibiotics to try and eradicate the cough is worthwhile. The antibiotics that are most useful, let's say for lower respiratory tract infections and even for sinusitis, is augmentin. Can be hard on the gut. Second, third choices. There are others. Clindamycin is actually a pretty good antibiotic, especially for organisms that tend to be more resistant. I often use it or resort to it as a second and third line for sinus infections, less often for lung infections.